Hello, dear aquarist, dear fish keeper, maybe importer, maybe pet shop, maybe serious hobbyist, or maybe exporter. Because today it's about a wild Corydoras catfish. A very nice Corydora, but also with, well, some nice diseases, which of course, for me as a fish doctor, it's great to see a lot of parasites that I can see with my microscopic observations. It teaches me always lessons, and wild fish keep on repeating that wild fish have very often worm infections. And today it's about a Corydora concolor that was suffering after it arrived at an importer. And of course, a job for us to identify, in this case 364, that the Corydoras concolor had several worm infections, nematodes, Acanthocephalus, and also encapsulated worms. So it was interesting case. So I'll show you my findings. But first of all, I want to show you my books, which are available in several languages, and the link is below where you can order them. With That contain a lot of photographs that helps you to identify diseases, that helps you to learn fish disease diagnosis, and especially helps you what medications you can apply. Here I show you the skinny Corydora concolor. Well, not looking full body. Here a picture, you can see the skinny distal part of this Corydora concolor. And after a couple of days or weeks, people die. And we had this in the aquarium. There were about a couple of hundred. And every so many days there was one dying. Well, time to examine what is going on. We found that the gills had some lesions, had some parts missing, had some lamellae which are not working properly. Was it due to the weakening of the fish? Maybe due to other infections that can have an impact on the gill tissue. Well, when we took that fish out of the aquarium, and we saw immediately a worm trying to escape from the anus of the fish. And that's a Camallanus worm, which is usually sometimes sticking out of the anus. Look, it looks like a mosquito larvae. No, it's a nematode. It's the red Camallanus worm. And here I show it to you in a microscope at 40 magnification. It's a big worm. The problem with Camallanus, it's a live bearer and he produces baby worms that reinfect the other fish in the aquarium. In the intestine, we found also a hookworm with a lot of eggs. This is called Acanthocephalus. Here is the hook. And that can cause serious lesions to the intestine, making holes, and cause that is killing the fish. Also see the air bubbles in the intestine, which is typical for Corydora catfish. That's what they use for gas exchange. They like to pick up air from the surface of the aquarium and take it down in their gut. Here we see the proboscis, that's the hooked head. And sometimes you don't see it, that it's retracted. That's a kind of way that the worm is living in the intestine, retracting and expelling his hook. Corydoras concolor also had nematodes, several nematodes, and some were encapsulated, all affecting the organs of the fish, taking away healthy tissue, weakening the fish. See how many here? Luckily, they are encapsulated. That means the fish developed an immune system or a way to protect it against the roundworms because they were alive and they took action. So the fish had some way of controlling this worm infection, but still had Camallanus, still had the hookworm. Well, the fish was suffering. Here we see a lot of bacteria also in the water here, all those dead tiny black spots. We saw also that the liver was very poor condition. We found in the gut also filamentous algae in this time that he has been eating somewhere in the aquarium. Interesting to show that it's not a worm, it's not an infection, it's a normal healthy algae that the fish can use as a nutrient. Filamentous algae in the intestine. The Corydora, the treatment, well, as I explained you in many of my previous videos, wild fish can have worm infections. You can treat with several medications you can choose from, or depending on what you can get from your fish doctor, like Levamisole, Fenbendazole, Praziquantel. Maybe think about treating the secondary bacterial infection. Ask your veterinarian, ask your fish doctor. And you can help with a functional fish food. During this worm infection, you can help to repair the fish, improve the immunity, and I could recommend Dr. BASSLEER BioFish Food Pumpkin, which is made from a pumpkin seed extract. My books on fish diseases, if you don't have them, the link is below. They are very practical tools to understand more about fish diseases. And if you want to go further, go to my Patreon channel where I teach you about aquariology, the secrets how to maintain an aquarium in good condition, about diagnosing fish diseases, about quarantining fish, many opportunities that I share with you that you can learn from. So I hope this video also teached you a lesson on this specific fish disease of this Corydora catfish. If you want to learn more, subscribe. You continue to learn. Important when you keep fish, learning never stops. Problems always can come around the counter, and it's important to find out what is causing the fish to get sick. I hope all my videos teach you the lessons which are needed to be a happy aquarist. Thank you for watching.